Becky, thanks for joining us as we take this deeper dive into our supported housing work tonight. First, I want to take a moment to discuss Milwaukee County's homelessness work and some recent news stories that many of us have seen. Milwaukee was recently recognized by the U.S. Department of Housing and Urban Development with having the lowest unsheltered homeless population of any community per capita in the nation. This is a wonderful accomplishment, and it can be a bit confusing. Tim, what exactly does this mean in terms of our community's overall homeless population?
Well, you're right, Renee. It is an amazing testament to the collective work that our community has been engaged in over these many years. And you're also right that it's incredibly confusing to a lot of people. And I can't tell you how many folks have approached me and said, "Isn't that amazing that you've ended homelessness?" The reality is, unfortunately, we have not ended homelessness. We've made great strides in ending chronic homelessness. And that's a very specific group of individuals who have experienced protracted long periods of homelessness. And that's really where a lot of our community resources have gone. But we have not, unfortunately, ended homelessness here in our community. It's something we are all working diligently to achieve. We have great reason to be optimistic that that is achievable, but we're not there yet. What this really means is that in January of every year, HUD, as one of our primary funders for homeless and housing resources, they ask us to do a count of individuals who are living on the street, who are in unsafe, uninhabitable living situations, to get a sense of the extent of unsheltered homelessness. Now, over the last 2 years, we've seen some pretty dramatic declines in the number of people that we have encountered on the street, but there's a reason for that. We have made a collective effort to use some of the emergency American Recovery Act funds to put people who otherwise are in need of crisis housing but cannot access emergency shelters into hotels. And so we have housed hundreds of people, individuals, young people, families with children in 4 to 6 hotels over the course of the last couple of years to get them off the streets and get them out of the most vulnerable situations during a time of year where the weather proves life-threatening for people who are attempting to survive. That's an important effort, but that by no means still leaves people experiencing homelessness and housing instability. And so I think that's an important distinction. It's really been effective work. It's created some new opportunities for us to shelter people when emergency shelters are either full and at their capacity or unsafe because of congregate care situations relative to COVID. And admittedly, there are people who the shelter congregate care environment is not the most conducive because of their extensive mental health challenges and trauma. So hotel placements are an important and critical resource to get people off the streets. That's what the count that we are reporting to HUD is indicating. We've gotten an exceptional number of people off of our streets and out of immediate danger, but they're still homeless.
Right, that's awesome. And thank you for describing that distinction. So it's a small sliver of what maybe the entire homelessness population is in Milwaukee. Would you give us an idea of what some of those other populations might look like?
Sure. HUD really focuses and asks communities like Milwaukee to prioritize our available resources to those who are literally homeless. It's what's sometimes referred to, and I'll get a little jargony, but category 1. Those are the most vulnerable individuals. And so our coordinated entry system, our housing screens and assessments, they all try to determine who is the most vulnerable in our community and prioritizes them accordingly to get the limited and available resources that exist. That leaves an awful lot of people out of that equation and out of that prioritization. We work with a lot of young people who are technically in what HUD calls category 2. Those are young people who are precariously housed, who are doubled or tripled up. They are house hopping, they are couch surfing, they are sometimes being exploited sexually or otherwise to get their housing and basic needs met, those are the precariously housed. Those are the individuals at imminent risk of homelessness. And unfortunately, because there aren't enough resources that exist to house everyone in need of safe and stable housing, we prioritize those who are literally homeless.
Right.
That leaves out by and far the vast majority of young people that we here at Pathfinders are working to safely and stably house and support.
Yeah, I think if you're not in this work and you're not, a policy wonk or someone who's really diving deeply into this work, I think what you described, certainly to me, and I'm sure to most people watching and participating in our work, would think, yeah, no, that's also homelessness. If someone's staying in their car, or if someone's maybe staying here for a few days and there for a few days and sort of cobbling that together, they're not safely and stably housed. They're not housed. So I think it's so important when we're talking about this work. There are certain definitions that are very much based in government. So, so that leads us to believe something different sometimes than what it really is. So Becky, when we talk about this entire homelessness bandwidth, how many young adults age 25 and under have gone through that housing needs assessment that Tim just spoke about and are currently waiting for housing support?
I know that as of today, there are approximately 240 young people who are currently awaiting housing. Now that includes young people who've reached out to 211 and are already on the coordinated entry wait list through the county. It also includes the young people who've come to Pathfinders to complete that assessment or who've reached out to our housing staff. What I think is notable about this group of young people is that these are not young people who anticipate a housing need or think that they may need housing support in a couple of weeks or a couple of months. These are all young people who need housing support now and are young people who are experiencing a housing crisis currently. And so they've reached out to say, I need support as soon as possible. And I think it can be very hard for providers across the system to recognize that these young people are going on a waiting list. And it's very challenging for us to say when, if ever, they'll be able to receive the support that they need and deserve.
Yeah, and just a couple of weeks ago, this list fluctuates a little. Like 3 weeks ago when you and I talked, we were up around 300. So tell me a little bit about that. This list does change and ebb and flow, and this is something you and I talk about regularly. And what might some of those reasons be?
It does. The number of young people on the wait list change nearly every day. Thankfully, some youth come off of that list because they find housing or because they leave Milwaukee County and are no longer eligible for those services. Sometimes it's that young people are just, we haven't been able to find them. And after a number of attempts, their category changes on that list. So they're not actively on the list as individuals that we anticipate being able to reach and to contact. So that number certainly does fluctuate. I think, unfortunately, we're pretty confident that that number is going to continue to rise for a while, particularly after the pandemic that we've all experienced. The need has increased for sure. And I think we haven't even recognized how deeply impacted the young people in our community have been, both from a housing standpoint, but even from a financial standpoint, which will eventually affect their housing stability.
Tim, is there enough funding resources in our community to house all of these young people?
The short answer is no. We use the number of 300 young people on waiting lists because that's what we see most frequently. As Becky just mentioned, there is an ebb and a flow that occurs on that wait list, both the coordinated entry wait list and then the waiting list that we keep internally as well for some of our specialized programs, for example, youth aging out of the foster care system and at high risk of experiencing homelessness as young adults. But I also think that number is a conservative number because there's an awful lot of young people that haven't even been screened in. They hear that there are no housing resources available to them. They are left, they think, to fend for themselves. And so we know the need is much greater than the actual numbers tend to reflect. And there has always been a challenge of trying to prioritize the individuals and families in our community who are most vulnerable with the actual level of need that exists. We're seeing a coming together of factors that are of great concern to us when it comes to the economic crisis, the moratorium on evictions ending, high rates of inflation, low rates of employment with livable wages. All those things come together to create a situation here in Milwaukee that is particularly troubling relative to the lack of housing that is affordable for the people who need affordable housing. You need a living wage to be able to afford housing, and we're seeing housing costs continue to climb. Now, granted, here in Milwaukee, housing costs are nowhere near what they are on the East Coast or the West Coast, but that doesn't mean it's affordable to the people who are experiencing housing instability and homelessness. And I think that's something that often gets missed in the conversations about what do we need collectively as a community to really effectively end homelessness and prevent it wherever possible. And that requires additional resources and collective community will to prioritize this issue for anyone experiencing homelessness or housing instability. And for us at Pathfinders, our youth and young adults who are in those precarious situations.